In the next video, we will demonstrate how to move a patient from his bed to a wheelchair using a patient's lift. For this technique, we will be using total assistance. So today I'm going to be working with
Suzanne Mack from the School of Physical and Occupational Therapy.
To use a lift, you need to be at least 2 healthcare workers. One thing to keep in mind is that you need to be very familiar with the equipment you're using, as it can pose a threat to the patient's safety. So the first thing that we're going to do is that we're going to ensure that the bed is at the proper height, so at hip level of the shortest healthcare worker. And we want to make sure that the brakes are on the bed. So first of all, we're going to turn the patient on its side to position the sling underneath him. So for this, I'm going to be using a forward-backward weight transfer, as we showed in a previous video. So Mr. Gonzalez, we're going to start by putting a sling underneath you, and then we're going to lift you using the lift. Is this okay with you?
Yes.
Perfect. So I'm going to ask you to turn your head towards me. You're going to cross your arms on your shoulder, and I'm going to ask you to bend your right leg. I'm going to grab onto your hip and shoulder, and on 3, I'm going to turn you towards me. Okay? 1, 2, 3. So using my forward-backward weight transfer, my elbows are slightly bent, and my weight is now on my back leg. For the sling, we're making sure that the yellow strip is in the middle of the patient's back, so it's going to be well positioned when we're at lifting the patient.
Just kind of lift up your foot a little bit.
Perfect.
There we go. Okay.
So now we're ready. We're going to go back down on your back. So 1, 2, 3. Perfect. And we're going to perform the same movement on the other side.
So I'll place my hands on your shoulder and on your hip. We'll bend your knee, and I will do the same forward-backward transfer.
Perfect.
And then I'm going to roll you back.
Sometimes we need to go back and forth a couple of times to make sure that the sling is perfectly aligned in the middle of the patient's back. Are you able to pull a little bit on the sling so it's in the middle? Perfect. So now the top of the sling is aligned with the patient's shoulder. We're going to position the lower portion of the sling. So we're going to slide that portion underneath the patient's thigh. And then we're going to cross them for better hold. So now that the sling is in place, we're going to bring the lift forward, while Suzanne is going to bring the head of the bed up to make sure that the patient is more comfortable when we're lifting him into the lift. You're okay, Mr. Gonzalez?
Yeah, thank you.
Perfect. You always have to keep in mind that the bar, you need to keep an eye on it to make sure it doesn't hit on the patient's chest or head. So now we're ready to put the hooks into the machine. So always one at a time, one side at a time. It's going to facilitate the movement. And now for the lower hooks, if your patient is going to sit in a chair, you want to use the one that's closer to the ground. So we're going to use the smaller hooks for this time. Perfect. So now that everything is in place, you have to make sure that one person is handling the lift and the second person is staying close to the patient to offer reassurance, as it might be stressful for some patient to be lifted in the air.
Now, Mr. Gonzalez, we're going to lift you up with this lift. You're going to be in the air a little bit, but don't worry, I'll be next to you to guide you to the chair. Okay? So don't worry, we're with you at all times.
Okay, thank you.
So I'm going to start lifting slowly and check the patient's reaction. You want to make sure that you don't put the brakes on the lift because it's going to adjust its position according to the patient's weight. Now, once the weight of the patient is going to be off the bed, Suzanne will come on this side to help guide where the patient is going to be going. Perfect. Okay, so now I'm going to be ready to move. So I'm going to slowly slide off the bed, always keeping in mind to keep an eye on the patient's head so no injuries occur.
And I will reach for the straps behind the sling to guide Mr. Gonzalez.
Perfect. So once you're on top of the wheelchair, we're going to start going down very slowly. And as you see, Suzanne is holding onto the sling and pulling backward to make sure that the patient really sits at the back of the wheelchair. Watch your head, Mr. Gonzalez. Perfect. Perfect. So you have to go down a little bit more to be able to remove the hooks that we're going to remove now. Oh, perfect. Perfect. Again, being careful with the patient's head. You can move the lift away.
Now to remove the sling, what we're going to do is just slip the straps that are under the thighs from beneath. And now what I'm going to do is just ask Mr. Gonzalez to lean forward a little bit. Ask you to lean forward. And that way we can slide the sling from under.
Are you comfortable, Mr. Gonzalez? Perfect.